Mr. Brown, you've just completed a course of treatment including some build-ups of your worn teeth and a replacement tooth at the front. And I'd like to just spend a couple of minutes just asking your experiences of the whole process. What were your thoughts going into the process?
Quite a long time ago, so it's rather difficult to say. I wasn't sure what journey I was starting out on.
What was your main goal at that point?
I suppose my main goal was to stabilise my teeth, actually, because I was grinding them happily.
And there was a severely broken one at the front, which you were conscious about, and we tried building it a couple of times, but it was just too damaged.
Well, the build-up disintegrated. So the implant, well, obviously the implant feels fine, but obviously it's only been in for about 20 minutes.
Okay.
It certainly feels fine and it looks fine, so that's a good end result.
Before having the sort of the implant put in, and we did that at the same time of taking out the tooth, what was the process like during and afterwards?
As far as I remember it all went pretty smoothly.
Was it painful? Did you feel much?
No, it wasn't painful. I don't recall any. The worst bit was the painkilling injection.
In terms of when we built your back teeth up, we did that in a sort of a staged approach. We did a mock-up of the teeth initially, and then spent a couple of sessions building those teeth up. How was each of those sessions for you? What was your experiences through those?
Well, I think it's fair to say I did feel it went on a bit, but I got, I'm happy with the results.
Yeah, it was just a long process at the time.
The only exception is, this front tooth here, the capping has come away owing to my unfortunate nail biting habits. Obviously, I'm going to have to try and control.
And we talked about using a night guard, obviously, afterwards in terms of protecting.
Which I will do.
Would you recommend to a friend of yours, if they were in a similar position, having an implant or not? What would be your thoughts?
Oh, I mean, I'd certainly say that my experiences have been fine, and so I'd be happy to recommend them here.
Yeah. Thank you. Thank you, Mr. Brown.